Students, welcome to lecture 15 in hospital pharmacy. As you know that in hospital pharmacy we were discussing the chapter health accessories, and we already discussed the first part, which was health accessory part first. Now we are discussing the part 2. So outline for today's lecture. In this lecture we will discuss about bedridden accessories and mattresses, bed safety rails, and trapeze bars, other bed accessories, which we will discuss later on, and orthopedic braces. So this is the main outline of today's lecture. These topics we will come across in this lecture. So bedridden aids. In this chapter, in this lecture, we will mainly focus upon bedridden aids and also the surgical lifts or the orthopedic aids, or which are also called the braces. And bedridden aids, as the name is self-explanatory, are those kind of items which help the patient getting up, getting out, or better sit position in the bed, or which makes their sitting or sleeping on the beds, especially in the unconscious condition, more safe. So these are various types. Important one are mattresses. Now mattresses seems very common thing, as when the name of the bed comes in the mind, along with that the mattresses come automatically. But the mattresses, especially for the bedridden patients and in the hospital, are of special kind of. First of all, they are made of polyform plastic, and those shouldn't be impregnated, and that's why with strains, and that's why they sometimes an extra covering of the plastic is provided to cover the mattresses with that. So along with that, besides safety rails, as I just mentioned, that sometimes it is quite a possibility the patient is unconscious, and during that unconscious condition it could fall out the bed. So in order to protect the patient, there are besides safety rails. Then trapeze bars help to hold and by their support the patient can get up and sit easily in the bed. Then bed cushions. Bed cushions help the patients to sit in a better position and in a comfortable position. And other bed accessories are there, which we will discuss later on. So mattresses. As I just mentioned that when the name of the bed comes, automatically the mattresses comes along with it. But why we are specially discussing mattresses, yeah, why giving a special consideration to the mattresses, the reason is that the mattresses, in case of the hospital beds, are not the normal mattresses. Either they are made of polyform plastics, or they are, if they are not as they are covered with the impregnated plastic, or if for example they are not made of that, then provide it with the plastic mattress cover in order to make it keep it clean and keep it protected. If you look at the mattress, usually it looks like this, and either it is made of the polyform plastic, which is helpful to protect the impregnations, or an additional cover which is made of plastic is usually provided. Then there are besides safety rails, and the safety device that prevents the patient from falling out of bed. We previously discussed that patients are sometimes in a condition that they are not very self-aware, or they might be unconscious, and during their unconscious state they usually could fall out of bed and may get further injured. So in order to avoid such a situation, safety rails are used besides the bed, and these are adjustable. These are removable. Anytime when these are not needed, can be removed, or these could be placed. So in the diagram we can see, this is one of the example of the beside safety rails. You can see that these are have been attached along the sides of the bed. Now sometimes these are usually adjustable or removable, and when the patient is in conscious condition or it needs to move from its bedding to another place, usually these rails are removed, and because now it is not needed. Another example is of the bedridden aids is the trapeze bars. Trapeze bars are overbed bars as an assist in getting up and out, in or out of bed by the patient. And trapeze bars, or as the name is itself showing, that these are actually bars which are over the bed, and usually by holding these bars, the patient are able to get up and get out of the bed, or in and out of the bed. So it makes the movement of the patient much more easier. In the diagram, you can see that how the patient is holding these trapeze bars, and she could easily get up with the help of these trapeze bars. Then bed cushions. As we are discussing about bedridden aids, so we discussed about the mattresses, we discussed about the besides safety rails and trapeze bars. Along with that, another item which or a health accessory which helps greatly in the comfort and support to the patient is bed cushions. Now, bed cushions are special cushions which help the patient in many ways. Like it could help the patient in getting up, sitting, and eating in a very comfortable and better position. So, bed cushions are which are usually given to the patients are well prepared so that they add to the comfort of the patient, and patient feels more comfy and more relaxed by having those, and their sitting sometimes becomes very easier. Their neck is having support, their back is having a good support, and apart from that, usually their eating process become easy with the help of these back cushions. The reason is that patient is usually not in a condition that it could achieve or it could incur or it could eat properly. So by having a good back support, back or neck support with the help of cushions, it becomes very easier for them to focus upon eating and in a much more relaxed and comfortable way. So bed cushions are playing a huge role in the comfort and a rapid healing of the patient. So there are some other bed accessories as well. Um, for example, over bed table, over bed trays, and other safety rails, which are usually used in the washrooms and bathtubs and for the cleanliness and other toilet purposes. These are used. These safety rules are rails are used for the patients. Over bed table and over bed trays are especially helpful in feeding the patients in a good way, or providing them, especially if you talk about the overbed table. Overbed table simply means that there is a table, there is an auxiliary table, which is removable, adjustable, and what it does that it provides a surface in front of the patient, and patient is able to get the food or to pick the food easily on that surface. Moreover, the medication could be served on that surface. So overbed tables help the patient to get fed easily or get the medication easily. Then there are the overbed trays. Overbed trays are also very helpful, as the overbed table is coming in the upward position. It is usually in the downward position. It is usually below the head of the patient, and what it does that it usually provides a container type location um, beneath the head of the patient, and um, the patient head could be shampooed or they could be cleaned, and in this way they are provided with various services despite the fact that they are in still in the bed, but different comfortable and cleanliness and treatment services are being provided to them easily while they are in the bed with the help of these various bed accessories. So over bed table, so as we were discussing that these this provide a service in front of the patient so that the patient is able to get their meals or medicines in a much easier way. So basically, the over bed tables are used to serve the meal or medicine to the patient, and this is a picture of the over bed table. We can see that this is having wheels and it is movable. So whenever the patient is needed to get the meals or their medicine, this table is adjusted in front of them, and on this surface they can have whatever needed to be served. Okay, over batteries. So we discussed about over batteries previously. That just contrary to the over bed table, which is a front surface, and um, usually it is above the table and in front of the patients. Over batteries are the surfaces which are below the heads of the patients. These are used for the washing and shampooing purposes. In the diagram, you can see this tray. This is our battery, and you can see that the patient head is placed in the tray and now it could be washed easily. So the cleanliness process becomes a lot easier with the help of these trays. Now orthopedic braces. So as you generally know about orthopedic braces or orthopedia, basically that this is a field of medicine which deals with joints or dislocated joints, bones, broken bones, fractured bones, and pulled muscles. So could be related to orthopedic branch, especially or the physiotherapy. And usually the specialists start treating such conditions, and usually along with the painkillers and other medications which help in healing the broken or fractured or the dislocated areas of the body fastly. Certain supports are needed. So here when we need these accessories, these items, and these are usually called the orthopedic braces. Along with the orthopedic branch, these might be needed in special surgical conditions when after surgeries, usually the support is provided to the surgery area, and so in that situation it is called surgical lifts. Uh, there are a few examples of them, and first example is a cervical collar. As you know that there are cervical bones in our neck region which are or especially very sensitive to dislocation. If we get dislocated or uh, let's suppose get injured, so it could be this condition could be extremely painful, and usually by its movement is usually when painful condition gets worse and the patient is suffering a lot. So in order to comfort such conditions, cervical collars are used, and in later slides I will show in a picture through a picture that how a cervical collar is supporting the neck region and basically the cervical um, uh, region in such a way that the neck movement it becomes very restricted or limited, and the patient is able to get healed more rapidly. Then there are shoulder immobilizers. Shoulder immobilizers also help to uh, the fractured shoulders or the dislocated joints. Shoulder immobilizers are providing a support. There are clavicle support, Clavicle bone, as you know, is a front bone just above the chest, and clavicle support in case of the broken fractured clavicle bone, clavicle support helps a lot. And so uh, this is also very important orthopedic accessory. The tennis elbow and wrist braces. These are also used for special. These are special orthopedic braces, which are used for these conditions in which usually the tennis players are suffering, and there are wrist damages or elbow damages. So, in order to support them, these accessories can be used. Arm slings for the broken arms, just like for the shoulder immobilizers. These also function in a way that it limits the movement of that specific area, and with much limited movement, the healing process gets very faster. So cervical collars. So as we were discussing that these are mild, soft support for the neck to limit range of its movement, and you can see it in this picture. This is a foamy, soft support, but this is very firm in its place. And because of this firmness and soft support characteristics simultaneously, which it holds, it very successfully limits the range of the neck movement. And so, along with its limitation and restricted movement, the cervical bones starts to heal better, and so condition is gets treated with the help of cervical collar. Okay, shoulder immobilizer. It keeps shoulder and arm still and used for dislocations. You can see it clearly in the picture. I think explanation is not much needed. We discussed it already in detail, that how these braces help to keep the dislocated areas of the body in immobilized position. And now the tennis elbow. It supplies pressure and support to the inflamed forearm muscles. Like you can see in this picture, this is a forearm muscle which is affected by continuous um, movement, and the muscle is inflamed, highly inflamed. So what this does, it applies or supplies pressure and support to the inflamed area. Wrist braces. Wrist braces reduce the wrist motion and protect it from strains and sprains. You can see in the picture that how it is supporting the wrist, and it is very adjustable and can be placed anytime or could be removed. Okay, the braces, we are continuously discussing about various types of orthopedic braces, and in that some other braces are also there which are equally important, as just like the cervical supports or the clavicle uh, cervical supports. So knee braces are there, one of them, and knee braces are, of course, as the name is indicating, they're supporting the knees. And then ribs and abdominal belts, uh, just like other supports, these could be used to for especially the immobilized ribs, or to immobilize the ribs and abdominal support, uh, and so helping the fractured and dislocated bones or joints. So these are various braces. One of the other important health accessories, which is another separate branch, and that is orthodontics. So as you know that in orthodontic, braces are also very important field of medicine, in which especially the dentist will require certain accessories all the time, and those accessories are helping the patient's teeth to get renewed or get repaired, or sometimes their position is fixed in a different way, or certain braces are fixed, and that helps to give them a good look. Also, it helps them to get better teeth, and with much healthier, you can say, chewing and eating habits condition. So orthodontics is also a very special field, and it's a whole other branch of different lot of other accessories. It is difficult to shorten it in one heading or topic, but orthodontic braces are mainly helpful to relocate and repair the dental areas and the teeth. Arm slings. So as you were discussing about various braces, so to consider about the arm slings is very important, because arm slings are usually seen on very common and routine basis in case of various uh, orthopedic braces, which are being used for the patient's comfort and well-being and their treatment. So basically what the arm slings do, they help to reduce the movement of the arm, reducing the strain and providing the support. So basically they are doing the same function what all other braces do, but the important thing is their location, and especially these are used to support, you can see, the arm region, and so it is reducing, you can see that it is fixed in fixed position, so it is reducing its arm movement. Secondly, it is reducing the strain which could be built up by movement of the arm, and it is also providing the support to the arm. So arm slings are especially helpful in treating the arm condition, such conditions. Diagnostic aids. This is another very important category of health accessories, and these health accessories help the patients when they are discharged from the hospitals and they are at home. It helps them to be aware of their condition and diagnose the little fluctuations in their blood pressure or the glucose level or the temperature or many other elements which could be detected, and the patients can keep themselves up to a significant level aware of their condition. So, few of the examples which are part of this set of health accessories is thermometer. In case of thermometer, there are various modifications of the basic thermometers which could be used very easily at home, with very precise and correct results, like the oral one, which is a very conventional, and at every home it is present. Moreover, there are electrical or liquid crystal thermometer. Electrical liquid crystal thermometers are highly precise and give very precise results. When they are a liquid crystal thermometer, when is applied to the forehead, it gives very minor fluctuations in the temperature of the body. So these are highly reliable thermometers which could be used at home successfully by the patients to evaluate their temperatures. Then there are blood glucose test kits. In case the patients are at home and diabetic, which condition, which is a chronic condition, definitely patient is facing it on day-to-day and basis. So they have this constant need of confirmation or to be aware of their blood glucose levels. So for that purpose, blood glucose test kits can be used at home, and there are digital devices also in this regard, which could give a very precise results about blood glucose levels. There are ketone test kits. Now, these are also giving the indication of glucose levels of blood, but not the blood, but urine. And they usually are very helpful in understanding the fluctuations in blood glucose levels in the body. Blood pressure monitoring devices, just like blood glucose test kits, are helpful to be aware about the changes or fluctuations in the blood pressure. And these could be manuals or off, or various digital devices are also there in the market now. And these are the few examples of home diagnostic aids which are very helpful and help the patient a lot being at home. So students, this was all about the various kinds of health accessories. I hope that till now your concept about the various health accessories would be clear, and it would be really clear to you people that it's not only the medication which is required for the patient's treatment, but there are also various kind of health accessories are there which are equally important and which are used so often and so frequently. But usually, as we refer to the medication, and we are mostly we are concerned about the drugs, we are not that well aware about the health accessories role. But you can see that health accessories have their very important role in the well-being of the patients and their fast recovery. So this was all about health accessories.